So let's start. So the objectives really is just to help you to appreciate the importance of seeking answers. So, once there's an event, how do you go about, seeking answers as to what happened, but with an aim not to blame, but to sort of identify systems that need to be improved or redesigned. So this is very important. And also to think through who needs to be on your team. And then in terms of the root cause analysis process, how to go about doing that. So let's look at this scenario. So we have a patient who is Margaret. She is an elderly lady with dementia who has been admitted in a big health hospital for breathing problems. Peter is a well-respected nurse on the medical unit. He has been working there for 5 years, and he's recently been helping new nurses get orientated to work in his part of the hospital. Today, he is working with Amy, who is a new graduate who has just passed her exams, and she received her qualification as a registered nurse. Now, George is a respiratory therapist or a physiotherapist. It depends how you want to call George. Is actually called to come and see Margaret to help her with her breathing. He notes that she is not getting enough oxygen through the nasal prongs, so he switches her to oxygen by mask, which improves her symptoms. George sees Peter. Remember, Peter is the senior nurse, but they meet in the halfway, and he says, "Hey, Peter, I upped her oxygen." As they pass each other on the way, to their next task. So if you think of it, this could have been a better conversation, but they didn't get enough time to talk. So it is a busy day for George, who figures he will write his notes in the chat later, right? So he didn't get time to write his notes. Now at 3 p.m., Margaret is scheduled to go for a test in the radiology department on the other side of the hospital. Teddy, the patient transporter, what the people we call porters in South Africa, arrives to take Margaret to her test. Peter, the experienced nurse, is in another patient's room assisting one of the doctors with the placement of a sterile central line. When Teddy asks if there are any special concerns with Margaret, Amy, remember, she's the junior nurse, says no, she's all set. If Amy had known about Margaret's oxygen mask, she would have accompanied her to the test. While being transported, Margaret knocks her mask off her face. When she arrives in the radiology department for her test, she is not breathing. Teddy calls the code team, but they are not able to revive her. So that means Margaret now has passed on. Now in the chat, as you went through this scenario with me, what do you think is the cause of Margaret's death?